Good morning, folks. It's Diamond from the Oppenheimer Ranch Project and Magnetic Reversal News, bringing you a COVID-19 coronavirus update. Facts, not fear. Sunday, April 5th. Total confirmed cases, 1.25 million worldwide. Well underreported. This could be over 10 million now. U.S., 324,000. Total deaths worldwide, still under the normal amount of flu deaths for an equivalent season by hundreds of thousands. So the death rate is not becoming exponential. The world is on lockdown. World markets are collapsing. And 4 months after the breakout, maybe even 5 months, we are now being told that we have to wear face masks in public. 5 months after the quote unquote pandemic was going to kill millions. And the result is that supply chains are being disrupted. Dairy farmers are forced to dump thousands of gallons of milk every day because they can't get it anywhere. Because we don't know what's going on. We are so incompetent as a society. And talk about incompetence. Let's talk about let's talk about Esper, the Secretary of Idiots. He's the guy who fired the Navy captain for trying to save lives. And he's going to send doctors and nurses to save us all over to New York. But they can't even put over a few dozen patients on the ship that docked days ago to save us all anyway. The U.S. reports the highest single-day coronavirus death since the outbreak. Yeah, that's because the hospitalization of quote-unquote sick people has increased since we started scaring the public. Grocery workers are the key here during the virus. And these underpaid people should be our heroes in the end. The people that work at the supermarkets all deserve a big hug, just not right now, in my opinion. And U.S. postal workers as well. Have you guys seen the headlines? The U.S. Postal Service could shut down by June. That would completely decimate and be the end game for the world as we know it. And this is also happening in the last few days. Doctors say hospitals are stopping them from wearing masks. And this is because they don't have enough masks for everyone. So if you have your own personal protective equipment, you're not allowed to use it in some hospitals because other doctors would be upset with you. This is the dumbest thing I've ever heard from an inept society that should collapse based on this idiocy. That if you have your own protective gear and others don't, you're not allowed to wear it or you're fired. Please read the article. It's absolutely disgusting. And now the results from a controlled trial of hydroxychloroquine for COVID-19 are in. And guess what? It works. Imagine that. And what's happening in Germany? Barely anybody's dying. They've got it under control, and it's basically over. Well, I'll tell you what's happening in Germany. It's basically over because we don't know what this pandemic actually is, and it's certainly not a pneumonia, according to this ICU doctor. Take a look at this. This was just published in the last 24 hours from a doctor with the sickest patients in New York.
I don't know the final answer of this disease, but I'm quite sure that a ventilator is not it. That is not to say that we don't need ventilators. We absolutely need them. They are the only way at this time that we're able to give a little more oxygen to patients who need it. But when we treat people with ARDS, we typically use ventilators to treat what's called respiratory failure. That is, we use the ventilator to do the work that the patient's muscles can no longer do because they're too tired to do it. These patients' muscles work fine. I fear that if we're using a false paradigm to treat a new disease, that the method that we program the ventilator, one based on a notion of respiratory failure as opposed to oxygen failure, that this method, and there are a great many number of methods we can use with the ventilator, but this method being widely adopted at this very moment in every hospital in the country, which aims to increase pressure on the lungs in order to open them up, is actually doing more harm than good. And that the pressure we are providing to lungs, we may be providing to lungs that cannot stand it, that cannot take it, and that the ARDS that we are seeing, that the whole world is seeing, may be nothing more than lung injury caused by the ventilator. Now, I don't know the final answer to this disease. I do sense that we will have to use ventilators. We will have to use a great many number of ventilators, and we need a great many number of ventilators. But I sense that we can use them in a much safer way, in a much safer method. That safer method challenges long-held dogmatic beliefs within the medical community and among lung specialists, which will not be easy to overcome. But I really believe that they must be overcome. There are hundreds of thousands of lungs in this country at risk, and the time to overcome them is now. I'm confident that if those of us that work bedside with these patients, those of us who are witnessing the things that we have never seen before, despite the many years we have worked and the thousands of patients and diseases we have seen, if we can effectively communicate this to all those that are so important but who are not bedside, the researchers, the administrators, those who procure our resources and make our protocols, the politicians, our own government, if we are able to convince them that this is a disease that is different than anything we have ever seen, I am confident that an answer can be found, that effective treatment can be discovered, and that a plan to disseminate that treatment can be rapidly deployed, and that tens of thousands and probably hundreds of thousands of lives and lungs will be protected.
Wow. Just wow. I will leave you links to the entire video. Please support this guy. I have his back 100%. You should too. Cameron Kyle Seidel from NYC ICU. Oh, he is a hero. Now, some more heroes. Coronavirus, COVID-19, fact, not fear. Government killer. Critical you see and understand this PDF. The charts below will actually make you happy, because what we're not seeing is an exponential curves anywhere, like would be predicted with a pandemic like the flu where millions die. This is not what's happening. And the actual numbers are not scary. You're just being scared by the powers that be. If you look at cases per 100 million population, you could see that all the cases worldwide have leveled off. That means they're about to fall off, which means that this pandemic is over based on the charts. And based on the fact that we are misreporting and misdiagnosing and potentially killing patients with the improper use of ventilators is even more disturbing. So I'll leave you links to the video if you can't read the PDF. I'll leave you links to the PDF of the video on the actual statistics, what they mean. Take a look. Here's the bump back on March 2nd in Italy. And you can see how all the numbers since then and how they project forward through April look. Are you picking it up? Please watch the videos. Please comment below. Another great piece coming out from Sky News is a special report today that I will link you to. Guys, keep calm. As this unwinds and we're all at home, we're all safe, and we all have time to do research. I highly suggest you send the video of the ICU doctor to all your friends. And
Time for this is now.
The time for this is now. Post it on all your social media. This guy went out on a limb here. He might have some huge backlash from this, but if we can save tens of thousands of lives and quell the fear based on facts, well, it'll be a new day. Thanks for watching. Be safe. We love you. That's about